All right. Good evening, everyone, and welcome to ATP Live Monday. I am Gimi Salaboide, your pediatrician for this hour. How has your day been? Welcome. And let's start by sharing the video. Let's share and invite everyone to be part of ATP Live Monday. ATP Live Monday is brought to you by Ask Pediatricians Foundation, and we're committed to the health and to the welfare of all children globally. And so, ATP Live Monday is one of our programs where you get to ask questions about the health of your children and you get your answers live from the pediatrician. So, welcome. Thank you so much for joining us. For those joining us on Instagram, you're welcome. Those joining on Facebook, on YouTube, you're all welcome. So, I'm just going to share the video as well, and hopefully, we can start. But if you have any questions, you can start to drop your questions straight away. I think let me just share it on my phone. Okay. All right. So welcome everyone. Okay. Welcome. And I'm just going to try and also pin the videos to all our various platforms so people can see and they can ask. But if you have any question, feel free to start to drop your questions now, and then we'll start to answer them. Welcome. I'm just trying to just give me a couple of minutes to do the video sharing and pinning, and then we can start to answer the questions that we may have. Uh, just a minute. Instagram people, you're welcome. Okay, so I'm just trying to share the videos, trying to see where I can see it. Okay. So, and then let me just go to the Facebook page. Okay. Welcome everyone. Feel free to drop your questions and I will start to answer them. I'm just trying to do a little bit of the pinning and the sharing so that we're able to. Okay. Okay. Right. Our system is a little bit slow today. Okay. All right, so welcome everyone. This is ATP Live Monday. This program is brought to you by Atp Pediatricians Foundation. We are committed to the health and the welfare of your children globally. And ATP Live Monday is just one of our programs where you get to ask any questions that you may have about the health of your children, and we will try and answer them in the next 60 minutes. But if you still have any questions after the live session is over, you are welcome to actually go to our Facebook groups and you can post your questions there. We're always there from Mondays to Saturdays. 24 hours daily, and so you can always feel free to post your questions and we will try as much as possible to answer your questions. We always give answers that are based on scientific evidence. So one of the things that you will get from ATP is that you can be sure that whatever answers we give to you is what your doctors would have given to you as well, so you can take it to the bank. So thank you so much, Alabisia Jenny Fuja. Good evening. Thank you so much for joining us. So thank you so much for those who have been joining me consistently every Monday. And we've been learning a lot. I think last week we talked a lot about immunization, and so I hope we all learned a lot. So Instagram family, welcome. Feel free to drop your questions. So while waiting for the questions, I will just try and reiterate what we talked about in the last week about immunization being one of the child survival strategies. And through immunization, most of our children are alive, and most of them are also free from some disabilities. For example, almost 1 million children are walking today, whereas such children would have not been able to walk because of paralysis from polio. But because now that we have polio vaccine, a lot of children do not have to suffer that paralysis. So this is just one of the example of the benefits of immunization. So we've been encouraging you to take your children for immunization. We tried to answer so many questions about immunization last week, and we also just to let you know that we are constantly updating and adding to the immunization schedule. So some of us we may need to take our children for additional immunization different from what was being given when our children first took the immunization. But just go to your health centers, ask them, and they will tell you. So I'm here today to answer any question you may have. Feel free to drop your questions. Start with the age of the child. Give a short summary of your concerns or the questions, and then I'll try and answer them. So while I'm waiting for your questions, I will just keep talking about immunization. And one of the things we try to talk about is the difference between routine immunization and what we call supplementary immunization or immunization campaigns or immunization days. So routine immunization is all those immunization that are listed in your children's immunization card. So we always tell you there's immunization to take at when the baby is born, there's immunization to take at 6 weeks, at 10 weeks, 14 weeks, then 9 months, then 9 years now, as or 15 months, sorry, before the 9 years. So those are what we call routine immunization. But once in a while, or every couple of years, sometimes we want to target a particular disease and we want to get rid of that particular disease, or there is going to be an epidemic of that particular disease, for example measles, and we want to quickly make sure all our children are well protected, or we're trying to kick out a particular disease like polio, for example. So we will give extra immunization to all the children in certain age group, for that particular period. So usually we'll come to you, we'll go to the children in the schools, we'll go to the churches, we'll go to mosques, we'll go to marketplaces. Those are what we call supplementary immunization. Those are what we call immunization campaigns. Those are like extra vaccines in addition to the routine ones that you have given your children. So the fact that your children have taken those particular vaccines as part of routine does not mean you should not take the extra one. you should still take the extra one. So because the purpose are a little bit different. So when we're doing immunization campaigns, when we're giving supplementary immunization, please make sure that our children take them. Don't say, "Oh, my children already taken polio before, vaccine before, or my children are taking measles vaccine before, my children are even taking MMR. So why should I go and take this extra one?" No, you should still take them, because the difference is that the routine one is just general to prevent, individual child, to protect individual child. But when we're doing the supplementary, it's a bigger scale, and we're trying to achieve a particular target, for a particular disease at the same time. And having so many children immunized around the same time gives what we call herd immunity. So many children are even protected, even the children have not yet taken immunization, and it also helps us to break epidemics, or particularly get rid of some diseases completely. So that is the essence of supplementary immunization. And those taking those extra doses do not cause any harm to your children. Your children do not get harm taking extra doses of vaccines. They are actually protected. So there's nothing to be scared or to be afraid of. So please let our children take those vaccines. All right, let's go back. I can see that many of us are around now. We can now start to good evening, Major Evers. Welcome on Instagram. Thank you. The first question is from Hope. Hope is also been consistent. Thank you for joining me. I said yesterday my baby of 8 months by 9 p.m. but breastfed him to sleep. When he slept like 20 minutes, he woke up vomiting. Okay, and go back to sleep, woke up again vomiting. Okay, that's very unusual, but I would suspect maybe either the child is sick. Sometimes when children are going to be ill, it may just start suddenly, and one of the first symptoms may be a vomiting, or it could be the child is having what we call indigestion. We should be very careful not to put children to sleep immediately after you finish feeding them, especially if you've given them complementary feeds. So make sure that there's some gap between feeding and before you put the children to sleep, so there will be time for the food to digest. So for an 8 months old, for example, the last major complementary feed should not be more than like 6 p.m. and 7 p.m. And so they should have at least 1 or 2 hours after that feed before you put them to sleep. So indigestion is one possible reason why a child could be vomiting, or it could also be that the child is overfed, but very unlikely if you are giving what we expect to feed the child. Or it could also be the first sign of a child who is going to be sick, for whatever reason, any of the malaria or any other illness. So those are the three possible things I could think of while your child may start to vomit. And so it's a little bit tricky to know which it is. But if the child is otherwise well and nothing else, I would just say you should just watch for now. But if the child keeps vomiting, then that may suggest an illness, and that means you have to take the child to the hospital for proper evaluation. So I think we've answered the question about what's the cause. So there are many possibilities of vomiting in children, and I think the most important thing is to know why and to try and deal with it. But the way you describe it, the first thing that will come to my mind is a child who is having indigestion. So try and don't overfeed children late at night, just before they go to bed. Make sure they have some gap in between. And but if the child is also having fever or any other illness, then that means there's something else, and you need to take the child to the hospital. Princess Oluwadamilola Stella, good evening. Oh, it's been a while. Okay, nice to see you. Thank you so much for coming. Okay, Hope is giving us additional information. So you feed him 4 times a day with breastfeeding. There's actually no limit to how often you can breastfeed a baby, and breastfeeding on its own will not make a child to start vomiting. But your child is 8 months old, so that means that child is eating other food. So I'm more concerned about the other food that you're giving a child, as at when did you give the last meal of the complementary feed, and how much of food did the baby eat and all that. So, but we don't know. Like I said, it's not just only indigestion; it could also be first sign of an illness. So if your child is still vomiting now, and you're worried about it, I'll recommend, taking the child to see a doctor for the evaluation. All right. So thank you to those who are just joining us. Welcome to ATP Live Monday. This is where you get to ask any question you have about the health of your children from a pediatrician, and you get your answers live and direct in 60 minutes. But if after the live program you still have questions, we have a Facebook group where you can post your questions Monday to Saturday, any time of the day, of the night, and we will try and answer your question. Of course, it's not an emergency line. So, in other words, if your child is very ill and very sick, you should take them to the hospital. But if you just want to ask general health information, knowledge questions about children health, you're welcome to ask on our groups. All right, let's move on. Your briefer Abigail, say good evening, ma. Please, how long should I wait before deworming my child? She's 2 years, 3 months old. Okay, thank you, Abigail, for that question. We recommend you start deworming children from the age of 1 year, especially if you live in places like Nigeria, where worms, we have what we call um high prevalence of worm infestation. It's an endemic area. Our children are exposed to worms a lot. So if you live in such area, if, for example, if you live in UK, US, they don't tend to have a lot of worms as a major issue. But if you live in Africa, sub-Saharan Africa, in Nigeria, we tend to deal a lot with worms. So we recommend that from the age of 1 year, you start deworming your children, and you can deworm them every 6 months. It doesn't have to be every 3 months. Some women do 3 months, but it's actually every 6 months, and you just give them the worm expellers, and it is just once. So there are many kind of worm expellers. The one we tend to recommend is albendazole. There are many different trade names. So worm expellers are one of those over-the-counter drugs. So you can just walk to any pharmacy shops, ask for worm expellers. They can give you any of them, and they will tell you what dose to use. But for albendazole, for a 2 year old, it will be 400 milligram, and that is the same dose even for an adult as well. From age of 2 to adult is the same dose for worm expeller. So usually, if it's a bottle, it will be everything in that bottle. Most likely will be that 400 milligram. It could be 10 mils, it could be 20 mils. Different companies do different formulation. But if it is 400 milligram, you give everything at once, and there's no time you can give. There's no specific time you have to give it. A mother was asking me the other day. I remember growing up, people believe that maybe when you want to do warm, you do it first in the morning or last in the night. Actually, there's actually no scientific basis for that. So you can give the warm expeller any time of the day. And it's not compulsory that the child has to pass worms. It is a prophylactic treatment. So if there are worms, yes, it will deal with it. If there are no worms, it will kill the ova or the eggs of the worms before they become live worms. So it doesn't mean you have to see worms. So you can use albendazole 400 milligram liquid, for 2 year old. Older children can take the tablets, and you can give it any time of the day. And we recommend that you do it every 6 months. So that is how to deworm our children. Deworming children is also important. It's one of the ways to prevent our children from having malnutrition or from having anemia, especially for those of us who live in Africa, where our children are actually exposed to worms and things like that. All right. Let me go to Instagram. I got a question from Fola Shade. Say you are going for the 14 weeks immunization next week. Okay. What can I use to ease the pain aside the cold compress? Okay. Number one, the child may not even have any pain. It's just like any other injection, you just have the injection and that's it. So, but if you're worried that the child is in pain, the paracetamol is good enough. There's nothing else to do. Just give paracetamol. Just make sure you ask them in the hospital what quantity to give, depending on the weight of your child. So they will work out the quantity of paracetamol to give your 3.5 months old baby. But most children are fine by the time these 14 weeks is the third time. So they've taken in that 6 weeks, they've taken that 10 weeks. Most time by the time they're taking it 14 weeks, they don't even really feel it much anymore. But if you think the child is in pain, you can give paracetamol. I think what are normally a practical point I always tell parents is be gentle the way you handle the children's legs. and ties after the immunization. Most of us just still carry them and they've just had an injection on that tie. So you need to be gentle, not to be pulling the legs or carrying it anyhow. Be very conscious of that. And like you said, if there's any swelling, you can apply ice packs. If there are no swelling, you don't really even need to apply the ice packs. And then you can give them paracetamol. Paracetamol is not just for fever, you can also give it for pain as well. And within 2 days, most children are fine. So that should be okay. I hope so. For Lashade, but if you have any more questions, please feel free to clarify. All right. Ifama, good evening, dog. Good evening. It's nice to see you today. Thank you. Your 10 months old have cough catarrh, which was brought on by the elder brother from school. Today's the second day. Read yes. You've read the Muscov and catarrh Aquera, yes. But she also has some high discharge that comes several times in the day. And not just only when she wakes up in the morning. So if a child is having high discharge that comes, that is persistent throughout the day, then that would suggest an infection. It could be bacterial conjunctivitis, it could be viral conjunctivitis, but usually most of the time, because we're not always sure whether it's viral or bacteria, most eye discharge we just treat them for like bacteria. So in other words, we give eye drops to the children. So we expect you to clean it with clean water, clean clothes, and then apply eye drops. So you have to see one of my colleagues to get the eye drops for the eyes. So okay. um yeah, and she's also having eye discharge. The eyes are not red. Yeah, sometimes the eye may not be red even with eye infection. It doesn't always have to be red. Yes, I agree that you need to take her to the hospital because she will need an eye drop. How old is this baby? 10 months old. Okay, yeah. So it's recommended that you should take her to the hospital and let them apply eye drops. But you can, in the interim, just clean it with clean water, clean clothes, and so that the discharge will come out. And be washing your hands, because most times if we don't wash our hands, you can from your hands transfer that eye infection to your own eyes or to other people's in the house as well. So just be mindful of the whenever you clean, you wash your hands, and then when you get to the hospital, they can prescribe appropriate antibiotic eye drops. That will be helpful. Okay, let's move on. Halabisi, Jenny Fuja, your 11 weeks has kata cough. Seems like everybody's having cough and kata today. I think it's the weather. I went to the pediatricians. Okay, good. So they've done the test. She placed that on Xenax. Okay, I'm afraid to give the antibiotics. Okay. So what is your question for me? You've seen the pediatrician. The pediatrician has done the test, and the pediatrician has decided to treat the child with antibiotics. I don't have any other advice for you than to follow your pediatrician's advice. I mean, recommendation. I think you should have this conversation with the pediatrician. If you are not um number one, for you to have gone to the hospital, it means you're worried about your baby, I believe. And this pediatrician is not even just treat your baby based on what you said alone. She actually did some tests. She didn't tell me the results. So I have a feeling that that blood test must have suggested to the pediatrician that this is maybe a bacterial infection ongoing, unless you are telling me that the full blood count came out normal. But even then, you have a right as a parent to disagree with us as doctors in terms of treatment for your children. You are allowed to disagree with us, but it's always good to have that conversation first. So I will suggest that you should have this conversation with the pediatrician who saw your child. So let them, because when you tell me, for example, if I'm the pediatrician who treated your child and you tell me I'm scared to give the antibiotics, then I'll be able to justify to you. I'll be able to tell you why I want to treat your child. Number one, the pediatrician has examined that baby. Did I pick up some signs of pneumonia in the chest? Okay, because every cough and catarrh is not the viral one. Some may actually be associated with some infection like bacterial infection. Did I pick up signs in the chest? Or is the child having fever? Did I pick up signs from the full blood counts that I did? Because trust me, most pediatricians, we don't like to prescribe antibiotics indiscriminately, and so we always, unless, well, at least I want to you saw a real pediatrician, because it's not every doctor you saw in the hospital is a pediatrician. It's not every doctor who sees a child as a pediatrician. That may just be our general doctor colleagues. So, but you should have that conversation with the prescribing doctor. Unfortunately, I'm not able to give you any advice about that, because it's, number one, it's not ethical. I didn't see your child, I didn't examine your child, I didn't do any blood tests for this child. So I cannot tell you don't or do. I can't. I'm not qualified to do that. The best person who can say yes or no is the person who actually saw the child. So you can still pick your phone and call the hospital and try to speak to the pediatrician if you want to speak to them. Discuss whatever reservation you have about it, and let them talk to you about it. And if you may come to an agreement, either to wait and see, or to see continue and give the antibiotics. So, but you have a right to have that conversation, but not with us, but it has to be with the pediatrician who knows and who have seen this child today. All right. Okay, but keep breastfeeding the baby, keep the baby warm, and then have that conversation with your pediatrician. Okay, the next question, Hope is asking, is strong, is active, is strong active when he's vomiting. He was playing today, he has eaten but he didn't vomit. Okay. I think my understanding now is that the child is no longer vomiting. I hope I'm getting that correctly. If the child is no longer vomiting, I would just say just watch for now and don't need to do anything. Most likely it's indigestion, because if it's indigestion, the child has vomited the undigested food, and the child, most time they'll be fine. So most likely it's indigestion. So make sure you are not feeding the child too late, just before sleep. After feeding them, let them have some little time of you know free activities and all that, for the food to digest a bit before you put them to sleep. All right, Abigail, you're asking again, how long should medication be kept after opening? Okay, cough syrup. Yeah, okay, that's a very lovely question. Maybe one day I should bring Tina to the group. But if you go on our Facebook group, Tina, our pharmacist, she has been doing a short video on all this kind of question around medication, how you give it, how you long you keep it, and all that. So the best thing is to read the leaflet in that medication. Every medication always has a leaflet, and in that leaflet they always tell you do not use after 7 days of opening and all that. That information should always be there. But if I remember correctly, for most of, which is why sometimes we try to give children tablets as well instead of syrup, because tablets, you can keep it until you open it, it's still okay. Whereas for syrup, once you open them, you have to keep them properly first. Some of them you need to keep them in the fridge, some of them you need to keep at room temperature. So always read that information. If they say keep in the fridge, don't keep in the freezer. If they say keep at room temperature, don't put in the fridge. All those simple information are quite important. And then secondly, they will tell you how long you should use it for. If they say 7 days, 10 days, and they will tell you how long you should, after you've opened, you should use it. So most syrup, most of them maybe 2 weeks at most. So, but the manufacturer would have put that information in the information leaflets that comes with the medication. And even the way they package medication, the syrup, most of the time they package it in a way that you should not use it more than that 7-10 days, because so if you are using it correctly, by the end of those 7-10 days everything would have finished. Okay, so that is also part of that. Is why some syrup, you see them, they're always small bottle, 50 mils, 60 mils. The idea is that if you use it for 5-7 days, you should finish using it. So we don't really want you to keep syrup for longer than 2 weeks maximum. So I think most of the pharmacists want you to use them for 2 weeks, and that should be the end of it. So but it varies from one medication to the other, but read the leaflets to know when. But like I said, most of our medication, antibiotics, most of them, if you use them correctly, you will even not have anything left after 7 days or 10 days or 14 days, depending on how long we want to use it for. I think the issue tends to come with things like paracetamol, because you use them 1 or 2 days, the child is okay, so you don't need it anymore. But even for those ones, we don't want you to use them for more than 2 weeks before you throw them away. Yeah, and things like that. So I hope that's helpful. Um, if I might say, my son will be 3 years old by March. He still wears that, but okay, I think you are potty training the child. Potty training varies from one child to another. So usually by the age of 2 years, we expect most children to be dry during the day, and by age of 3 years, they become dry at night. But it's a range, different children, different things. So we just always say, just potty train them, and that's it. Okay. So for bedwetting, we only worry about bedwetting from age of 5 years. So before the age of 5 years, we don't say a child is bedwetting. In other words, that child can still use nappies at night. If they can still wear the bed, we don't even worry about it. But once they're about 5 years, we expect majority, 90% of children to have become dry. So that is when we now start looking at it as a problem, and that's when we start calling it bedwetting or enuresis. So that is it. Um, so when will it stop being at time by himself? So it varies, but like I said, we are not worried about it until the child is 5 years. That is when it becomes a medical condition. If your child is wetting the bed after the age of 5 years at 9, that is when the pediatrician will get involved. Before then, we don't get involved. So what we will just try to teach you for the night: number one, try and limit liquid during the night. So they can drink as much water as they want during the day. In fact, we expect them to drink a lot of water. We then expect them to drink up to 6 to 8 glasses of water during the day. But at night, until 7 p.m., you should stop drinking. Yeah, and you should avoid things like all these juices, um, all those tea. There's some kind of drinks we give our children. They actually irritates them, and they actually make it easier for them to bedwet. So you want to also avoid that. Give them water. Water is better, but by 7 p.m. they should stop drinking water. And before they go to sleep, try and help them to go and void, so that they go and pee before they sleep. We don't tend to encourage waking the children up to pee, because you are disrupting their sleep, and sometimes some children it affects them. So but you want to make sure you limit water from 7 p.m. So they should have had their dinner by 6, 7 p.m., and that will be the last drinking of water. No other tea, no other juice, all those other things after that 7 p.m. And then before they go to sleep, they can use the toilet to to pee. Some parents, when they are going to their home bed around that 9, maybe 8 or 10 p.m., they also wake the children up to have it, what we call a double void. They go and pee again, so that may also help. Some children have very deep sleepers, so they don't tend to wake up even when they feel the urge to go and pee. So usually they're what we call bedwetting alarms. Bedwetting alarms can be helpful for such children. So in other words, you wear it into their pants. So once the first drop of urine gets onto the alarm sensor, it will vibrate, or it will bring out some noise, and that will wake that's the idea. It will wake the child up, and hopefully the child can go and pee. So you can also try bedwetting alarm. They're available on Amazon. They're something you can buy over the counter. You don't need a prescription for them. But sometimes some children, you just have to wait for their brain to mature to help them remember to go and pee when they need to pee. So, but usually by the age of 5, if the child is still bedwetting, then you have to come and see us as pediatricians for further evaluation and management. Oh, that's helpful. Okay, Instagram people, feel free to ask your question. I can't see any question on Instagram apart from Folashade. Um, okay, let's go on to Facebook. Jenny is saying, how do I measure scoop of formula to add to your baby's pap? How do you measure it? You just scoop it. There's no scientific basis for measuring. Are you asking for the measurements? Okay, like the quantity you need to give to the pap, Okay, if that's your question, yes, it's the same. You can use the same measurement you will give, like when you're doing your water. Like if you are mixing formula, you can do that. So there's no hard and fast rule about it. You can just do um what works for you, really. and and most importantly, I hope you know that it's not only milk that you can add to pap. Okay, so you can add your egg, you can add your crayfish, granules, palm oil. So there are many other things that you can use to fortify the egg, I mean the pap, when you're giving your children, so that it has a lot of, even your banana, for example, you can puree it into, you can blend it into your pap for your children. There are many ways to do that. And let's also remember that pap is not the only complementary food for children. There are many other things, your potato, your rice, everything can be mashed, everything can be given to children. So let's be mindful of all the other things and not just rely on pap. But there's no hard and fast rule about quantity of milk. And your children can drink the milk separately from the pap as well. They don't always have to drink it with the pap. Okay, I hope that's helpful. Let's move on to Jesu Tofumi Grace. Jesu Tofumi Grace is asking, um, my 1 year, 1 month isn't working yet. Okay, well, we're not worried about that. Some children work at 1 year, 50% of them work at 1 year, but some will not work until 18 months. So, but if after 18 months the child is not working, then you have to come and see us. Before 18 months, we're just not too worried about it. Okay, so just relax. The child developed cough and vomits a little while coughing. Uh, should I be worried? Though his upper teeth trying to erupt from his gum. Anyway, I don't always know why mothers always put teeth in along when they are asking this question about cough and catarrh and all that. Okay, let me just break it down by saying your child having cough and catarrh have absolutely nothing to do with teething. Okay, teething is something children do on their own, and it doesn't make them sick. It doesn't cause cough. It doesn't cause catarrh. This is like the third or second time I'm saying that today. So it doesn't cause cough. It doesn't cause catarrh. It doesn't cause diarrhea. Teething is something natural, something normal. It's absolutely normal for children to bring out their teeth, and they don't need to have any symptoms whatsoever when they're bringing out their teeth. They don't need to have cough. They don't need to have catarrh. They don't need to have fever. They don't need to have rashes. They don't need to have diarrhea. They don't need to have absolutely any symptoms. Your child can have cough and catarrh when they're not bringing out teeth. So there's no need for us to start tying them together. Okay, so it has nothing to do with the teeth. Your children can have cough and catarrh. This is like the third or fourth question about cough and catarrh we are dealing with today. So it seems like it's a season for it, really. So many children are having cough and catarrh. Most of them are due to viruses. Some of them can be due to bacterial infection as well. So if your child is not having fever, most likely it's a virus. And the good news about infection that are caused by viruses is that they will run their course and they will go away. So the children will be fine. You don't need to treat, you don't need to give them anything, you don't need to give them cough syrup, you don't need to give them anything. Just watch and it will resolve on the whole. If the child is having fever, if the child is having difficulties with breathing, in addition to the cough and the catarrh, that is when you now need to take them to the hospital, because that is when we're worried about pneumonia and the rest of them. Otherwise, there's nothing to do. Just watch and wait. Okay, I hope that is helpful. All right. Let me just check Instagram. Okay, Major Evans is asking question now on Instagram. All right, let's just answer the Instagram question. My kids don't eat boiled egg; they prefer fried egg. There's no law really how you eat your egg. You, of course, people think eating them boiled is healthier than the fried egg, but it depends on how often they eat the fried egg. Like, if it's just something they eat like every day, and then you are worried about the amount of oil. But if it's just something they eat maybe once in every 2 3 days, I won't really worry so much about it. So There's no law that you have to eat the egg boiled, or it can be fried. It's fine. It can be made into food, like you can pancakes and all those other things. Also, other ways of eating eggs as well. So my question: what can I do to make them eat eggs? I thought you said your children eat fried eggs. Let them eat the egg fried if that's what they prefer. There's no law that they must eat the eggs boiled. And there are, like I said, there are many other ways you can use egg in cooking food. You can break it into food, for example, break into pap, and the children won't even know they are there. You can make pancakes with eggs. There are many other ways. So those things, there are no laws. The important thing that the children, and they don't even always have to eat eggs. Eggs are good, but there are other sorts of protein. The meat, the chicken, all those other sorts of protein are also there. So there are some children that are allergic to eggs and they don't eat eggs at all. So we have to give them other sorts of protein. So it's not a law that children must always eat egg. Egg is good because egg is one of those food that you have all the protein, all the amino acid in just one food, so you can imagine how good it is. So that is why we love eggs as one of the most balanced source of protein for children. But that does not mean children must always eat eggs. Some children have egg allergy and they can't eat eggs, and so they have to eat their chicken, they have to eat all that sorts of protein. So as long as our children are eating variety, they will get all the different food classes from the different variety of food, because all the food always has one thing or the other. Even when we say things like this particular food is carbohydrate, doesn't mean that there is no protein at all in that food, or there is no other things in that food. It just means that that's a major food class that is present in that food, for example. So that is just what that means, but it's not compulsory that they must always eat eggs. Chisabel Konko, good evening. You're welcome. Thank you for joining us. All right, let me move on to Facebook. Just to for me, I did 6 months exclusive, and your child has refused to eat any other thing except breast milk after 6 months till now. So your child is a year and a month. So you mean your child didn't eat any other food for 7 months? I don't believe that. That sounds like an exaggeration. I know mom, I know there's what we call mom talks, but there's no way your baby can survive on just breast milk for a year and 1 month. It's practically impossible. What's the weight of the child? I want to know. That will tell me whether we need to do with something. So I am concerned that the being suspicious. I was told the child is healthy, even though he has reduced stress. What is the weight? I want to know the figure. All right. So if you so basically you're struggling with getting your child to eat complementary food, we do have lots of resources on helping mothers with complementary feeding. If you go to our Facebook group, we have a guide session. I don't know whether you've done that before. We have a guide session. We have about 6 to 7 videos on how to give children complementary feeds. We have a lot of podcasts on how to go about complementary feeds. We have a lot of articles on epi fussy eaters and all that. So you could also see a dietitian. They can give you ideas and tips on how to get your child to eat. There's no shortcut to getting children to eat. Okay, children have to eat, but you need a lot of patience and you need to make sure you are doing it right. I found that most of the time the problem is not with the children, the problem is with the mothers. We are always impatient. We give the child the food they won and they didn't eat it, and then we just assume they're not going to eat it. That's not true. You give it again, you give it again, you give it again. Sometimes we always say you have to offer one food 13 times, that is 3 times, before you can say this child will not take this particular food. Even the way we prepare the food, okay, the way we prepare it, the consistency, the texture, the color, all these things are important. The way we offer the food, okay, sometimes we give our children because they only take 2 spoons, we just assume, oh, that means they're not taking it. No, 2 spoons is fine. If that's the first time the child is eating the food, then you aim for 3 spoons the next time. That is patience, okay? We keep giving them the food. We're not force feeding them. We don't let them make food time to become a battle time, So there's no way your child will survive with only breast milk for 13 months, that child will be malnourished. So if you've been to the hospital and they are saying the weight is fine, so that means you're still giving something. And then sometimes we also have the wrong approach in terms of the quantity. The quantity that children have to eat, it's not the same quantity they take as liquid when you're giving them breast milk. Okay, when they're eating solid, the quantity is actually smaller. Okay, because there's more calories in smaller quantity of solid compared to liquid. So these are all the kind of information we need to have at the back of our mind. And of course, a lot of patience. We need to be patient. And also the frequency of feed. For example, for a 6 month old, we expect them to be eating complementary just twice a day. So they don't need to eat every 3 hours complementary feeds, because some of these things, these are some of the things that make mothers say, oh, my child is not eating, but because you're actually wanting to give them more than what they actually need, or we are trying to overfeed them, or we're trying to force feed them. So some children are fussy eaters, no doubt. With some children definitely don't like eating much. There are children like that, but it's even for the fussy eaters, they will still have a few things that they like, that you may have to give them more of it, or you find a way of hiding other things in their food. So, but like I said, if we talk about complementary foods, we have lots of resources already on our Facebook group, on our podcast. I think it's one topic I think I've talked about. We have loads of tips. Even if you go on our Instagram page or even on our Facebook, you see all those pictures we always give about tips for complementary feeding. So you may want to go through them. But it's very important that we are patient. It's very important that we are not rushing, because there's no magical thing I'm going to give you. There's no drug I'm going to prescribe for you that will make your child to start eating. The treatment for a child who is not eating is to give them food, and just to do it in a way that the children will take them. Sometimes the dietitian will give, for the very first eaters, if they are losing weight, they may give them supplementary powder and things like that to add to the little things, just to increase the calories even with the little quantity they eat. But it's still food we're going to give the children. Okay, so you've not really told us the age, the weight of your child, and some of your posts has been cut off. The child is not working. I'm not worried about a child who is not working at 13 months. I said if the child is not working by 18 months, then that is when I will worry about it. All right. So just for me, I don't know. So most of your questions were cut off, so I didn't see the last part. But feel free to put it up if you are still listening to me. Then I will address them. All right. I will just go to Instagram. Chisabel. Good evening. My baby of a year, 8 months, out of Qatar. Okay. This is the sixth one. I think it's just cough and Qatar day today. Okay, so it's something going on in the hair, maybe in Nigeria. Um okay, she also had fever. Okay, he gave paracetamol, and she has lost appetite for food. Yeah, so if your child is having cough catarrh and they now start having fever, then we're worried. It's not just, most likely, it's not just viral now. This child is becoming ill. The child is also losing appetite for food. The child is having fever. Then how, and that's been going on for 5 days. So, say you have fever 5 days ago. The child said, okay, the fever has stopped. Okay. Um, I would really recommend that you should just see a doctor for this child. And I'm worried about the weight of your child. Are you sure of that weight? A year, 8 months old baby is weighing 16.9, like 17 kilos. Are you sure of the weight? Is that a typographical error? Please, can you confirm? Because your 1 year old should not be weighing more than 10 kilos. A 2 year old should be weighing 12 kilos. So for your 1 year, 8 months, I expect a weight between 10 and 12. So if that child is weighing 17 kilos, I'm definitely worried about it. I'm worried about a 1 year old who is weighing 17 kilos. That is really too high. For comparison, an average 5 year old will weigh 18 kilos. 5 year old will weigh 18 kilos. So if a 1 year old is almost weighing the weight of a 5 year old, I'm worried about it. Unless there's an error with the tape, with the measurements, or it's a typographical error. I don't know which one it is really. But I really want you to go and check that weight again in the hospital, because it's very important. We want children to have good weights, but we also don't want it to be too much. Both too low a weight or too excess a weight they are problems for us. So we don't. They are both malnutrition. Malnutrition is not just about underweight. Overweight is also malnutrition, and it worries us a lot. So I think it would be good for the child to see a doctor because of the fever, the cough and the catarrh, and now the child is also having poor appetite, and the child's weight is too much. I really want the child to be seen by a pediatrician so that we can be sure what is going on. So yeah, so this is a child that I would recommend should be seen in the hospital. All right, let's go back to Facebook. Hadiola Damilola, first time of joining live session. Hey, we should ring a bell for you now. Welcome. Thank you for joining us. Oh, you just want to appreciate some members of ACP. Oh, that's nice. Thank you for your kind words. God bless you all greatly. The foundation has been a great benefit. Oh, thank you so much. Thank you. Oh, you didn't have a question for us, but you just want to commend us. Thank you. We appreciate it. Deborah Halaye, say please, ma, what makes a month baby stomach to make sound? Okay, what makes it is gas, is hair. Even your own tummy can make sound. I hope you know it's not only babies, even your own. So don't you see people's tummy making sounds when they are hungry? You have what we call um rumbling in the tummy. It's just gas, and it's absolutely normal, and I'm not worried about it. Even in the newborn, it can happen in adults as well. It's completely normal. All right, so don't worry about it. Prince, you smile. Good. Hello, dog. Hello, Prince. Two daughter. One is constantly complaining of headache. How old is she? Specifically at the forehead, almost on a daily basis. How old is your? Okay, 6 years old. 6 year old complaining of headache. It's not normal. It's not normal. Have you checked her eyes? Has she had an eye check? Because that's the for children who are short sighted. Sometimes the first sign is that they tend to have headache because they're always straining their eyes and squinting their eyes. So I want her to have an eye check done. And then if it's also complaining of headaches, any vomiting with it, especially early morning vomiting, I worry about it as well. So headaches could be something as minor as migraine or an eye problem, but it could also be something as sinister as a brain tumor. So we really don't joke around with headaches in children, especially if the child is really, really having serious headaches. So I will really want this child to be seen by a pediatrician. So you definitely need to see a pediatrician about that headache child. As the child had like a brain scan and things like that, he had an eye check, you definitely need to see a pediatrician for the headaches. It's not normal for a child to be having headaches a lot. Most children actually don't complain of headaches, but if a child is really complaining of headaches, that child needs to be properly evaluated. Yeah. Okay, then said second is diagnosis of H. pylori. We tried all treatment humanly possible, but no hope. I don't know, what do you mean by all what do you mean no hope? What are the symptoms the child is having before the diagnosis of H. pylori? I'm more interested in that. And what treatment has been given? H. pylori is treatable. It's an infection, it's treatable, and most people we can get rid of it. So it's not something like there's no hope for. No, that's not true. It's not cancer, it's not any of those, it's not HIV, it's not any of those kind of conditions. H. pylori is a treatable condition. So we need to be first sure what, and I really always want to know what are the symptoms, not what the diagnosis, because we need to be sure the diagnosis is even correct to start with. Okay. Yeah. So, and okay, so they've done an endoscopy. Yeah. The last option which we were advised but didn't try is, and I'm afraid is endoscopy is a very straightforward thing. It's not something to be afraid of. It's just looking into the intestine with a microscope. We're just shining lights and looking into the intestine of a child. It's a very simple, straightforward procedure. There's no reason for you to be afraid of endoscopy at all. So out for your 6-year-old with headaches, I want both children to see pediatrician. I'll really prefer they see pediatrician in the teaching hospitals because those are the best places to see the experts. The 6-year-old preferably should see a pediatric neurologist, and the 7-year-old with the H. pylori should see a pediatric gastroenterologist. So, which is why I was suggesting teaching hospital, because in the teaching hospital you will see the difference, not just pediatrician, but the different specialties as well. So, like the 6-year-old with headaches, if there's not an eye problem, it's not migraine and all that, I really want to be sure the child doesn't have anything growing in that head. So we really need to have a brain scan, especially if it has been going on for so long. And then the endoscopy you say you didn't want to do, you will still really need to do it. So, but then you see a pediatric gastroenterologist, they will take it from there. But H. pylori is treatable, very, very treatable. Yeah, sorry. The ailments are draining holes, especially in the night. Sorry about that. But I think you should just see the specialist first. You didn't tell us your location, but can you go to the teaching hospital in your location? The tertiary, either a teaching hospital, a federal medical center that has pediatric Okay. Yeah, Ozavizevi. Good evening. My daughter of 4 months, 2 weeks, P last week, Monday, with a stain on the diaper, like red, like light red, not red like blood. Okay, I wash her and change diaper. Then the next day was free of the stain. She's active. So it's either the child has what we call urate crystals. Sometimes it tends to look more pink and pinkish or orange kind of color. We call it urate crystals. Sometimes parents tend to think it's blood, but it's just one of those things in the urine, especially when the child is dehydrated. So make sure you are breastfeeding your child frequently. Make sure she's drinking a lot of breast milk so she's not dehydrated. So most likely it's urate crystals. That is the one that tends, it looks more like orange or pinkish rather than bright, but we don't worry about it. We tend to see it a lot in children who are dehydrated, but make sure your child is breastfeeding very well. Okay, just to for me, your question, maybe it's 1 year, is 10 kilos. Okay, the weight is good actually. Your baby has a perfect weight, so that means your child is eating. Even though you are telling us the child is only taking breast milk. I doubt the baby will have 10 kilos weight at 1 year if the child is only on breast milk. Very unlikely. So I have a feeling that maybe your expectation of how much your child should be eating is what you really need to work on. So this kind of question is a little bit tricky to answer. So it would be nice for you to go through those guides section, watch all those videos, make sure you know what is the right quantity of food, the right frequency of feed, and everything we want, so that you can know what is right and adjust your expectation appropriately. Because some of us, I think we just want the children to eat and eat a lot. Not necessarily. The child is still taking breast milk, so they will still get a lot of food from breast milk, but they need to eat other food apart from breast milk as well. So, but if your child is having good weight, that means your child is getting enough food to maintain a good weight. So most pediatricians and dietitians will not be worried about your child, but we still want the child to eat more than breast milk. But you see, the most objective evidence whether a child is getting enough food is the weight. It's more objective than all the stories, than all the things parents tell us, because we know it is science that this is, before you can add weight, you need to have something coming in. So that is why we don't rely on just what parents tell us. The weight is more objective. We're not saying the parents are not telling the truth, but the weight is more objective in trying to tell us whether the child is having enough calories built in the body, because they need the calories to gain weight. Okay, so it may not be what you think the child should be eating is not enough, but the child obviously is eating enough to maintain a good weight. So that is a good positive thing. But you now need to look at working on strategies to get the child to eat other food, and let the child eat the same food you eat. Sometimes some of us want our children to eat some of these canned products. The number of times people parents will ask and say, "Oh, my child doesn't take pap, doesn't take baby food, but my baby wants to eat the same food we eat." And I'm like, seriously, that is actually the right thing. Baby should be eating what you are eating. So let your child eat the same food like the rest of the family from age 1 year. There's no baby food in quotes, okay? Food is food. Okay, so the it's just that when children are just learning to eat, you tend to give them in a smoother, softer texture, porridge like, mash like, and then as they get older, by the age of 1 2, then you start giving them the full, normal solid texture kind of food. Otherwise, it's the same food we eat. So if your child wants to eat the same food you eat, like the pap and the swallows and all those, if you give them to eat, so they don't necessarily have to eat canned product, because that is what people call baby food. They don't necessarily have to eat all those cereal, in quotes, or they even take pap. They don't have to take all those kind of food. Let them eat normal food, the same food the rest of the family is eating, and that is it. So I hope, just go through the guide session first, and that's it. You will be fine. Okay, time is up. I need to round up, but let me just answer the questions that have come in first. Shizoba, are you still on Instagram? I really want to know that question. I'm asking about the weight of the child. Can you confirm whether it's a typographical error or it's correct? I really want to know. So if you are still live. What made baby not to cry immediately after birth? Oh my, that's a whole 1 hour question. But you need to go. I think we've done a podcast on birth asphyxia, so if you want to really learn about it, go and listen to the podcast on birth asphyxia. That is what we meant when the baby did not cry at birth. We call it birth asphyxia. There are many reasons. It could be things to do with the mother, it could be things to do with the baby, it could be things to do with during, before the baby was born, inside the womb, when the baby was being born, even after the baby has been born. So there are many things that can make a baby not to cry as well. I had it's due to the height of the mother. No, it's not. It's not. It's not due to the height of the mother. Okay, so but I will not have the time to tell you everything. But we have a podcast on birth asphyxia that you may want to listen to. There are many reasons. Okay, it's not one reason. Okay. All right, but the most important is that that's why a baby should be delivered in a hospital where doctors, nurses are trained in what we call neonatal resuscitation. So we're able to get that baby breathing within the first 1 minute of life, the golden minute. So that is it. How do I stop my 5 month old? 5 month old. You can't stop a 5 month old from sucking their thumb. That is something, it's more like an habit for them at that age. You can give them something else to hold in their hands and all that, but you can't stop the baby. But the best thing you can do is that when your baby wants to suck and all that, when they're giving you cues, you respond to it faster. Don't wait until baby starts sucking on their hands and all before you respond. That is how babies tend to pick up those habits, and once they become an habit, it's an habit. So we tend to worry, but most of them will outgrow the habits, and it becomes an issue between the age of 4 to 6 years. That's when we start to worry about it. But before then, the best is for them not to have developed the habits. But before then, there's nothing you're going to do to force them to stop it. What are you going to tell a 5 month old baby about stop sucking their thumb? But you need to make sure you respond to the child quickly, because most of them use it as a comfort item, and when they are hungry, so that is what normally leads to it. And sometimes they just find it easier to suit themselves sucking their thumb when mommy has not responded on time. So, and then after a while, even now when you're responding, it has become an habit, but hopefully they will outgrow it. All right, Daniel, thank you, Ma, and the other people for your sacrifice in this platform. Thank you so much for your kind words. So today's a good day. Everybody's very nice and kind and lovely. Thank you. Please, what's the average weight of a 2.6 kg? Okay, what should be the weight, of a 2.6 kg at 6 months? So we just normally say that babies should double their birth weight around 6 months. So double. So that is what we say. So if you go by that, if baby was 2.6 at birth, then by 6 months they should be weighing at least 5.2 kilos. That will be averagely. It could be a little bit more, but definitely not less than that, because it's between 5 to 6 months that they double. So that will be 5.2. So if baby is 5.2, I'll be happy. All right. Okay. Oh my goodness, the questions are coming up when I just thought I'm going to round off. Okay, thank you, Jesus. So for me, okay, so do the guide session. Trust versus mistrust. I don't know, Shinaya, what is that about? I can't remember. Did you ask a question before about trust versus mistrust? I can't remember what this is about. Prince Usma say, thanks for your fault. Okay, the H. pylori was frequent chest pain. Okay, you've done scan, X-ray. Okay, you are in teaching hospital Zaria. Okay, good. Went to prescription. Then we saw a pediatrician in Kaduna, and H. pylori was confirmed. She recommended, yeah, sure, yeah, good endoscopy, but due to difficulty, I'm surprised you say endoscopy is not difficult, but maybe you should read about endoscopy online first. It's not difficult. They're just passing a tube and looking in. It's just looking with a light, but they just at this time around we're looking into the intestine. It's a straightforward procedure, but it's okay if you don't want to do it as well. But if your child is still having symptoms, the gastroenterologist will want to do it. Okay, so yeah, I don't know whether they have gastroenterologists in ABU's area, but I'm sure they have a pediatric neurologist for the child that is having headaches. So that is my own field. I don't know much about the gastro field, so I'm not sure whether they have one, but I'm sure they have a pediatric neurologist that will see the child. Yeah. Okay. Your question was cut off. I guess you want to tell me you are based in Zaria or Kaduna. Yeah. ABU Zaria should be good. He hasn't gained Chino Dani, he hasn't yet gained leg weight to stand. A 5 month old does not need to stand. I don't expect a 5 month old to stand. A 5 month is just practically learning to sit with support. So we don't need to start forcing the children to stand. We don't need to force them to stand on their legs. They don't need to stand at 5 month old. Okay, standing is 9, 10 months old. In fact, 1 year old skill. So there's no reason for you to force the child to sit or to stand at 5 months. You may need Chino Daniel. You need to go read our article on the normal developmental milestones. Just read about it so you know what is expected for each age. It's the brain that determines what a child does at each age. You can't force the child to do what they're not ready to do. So at 5 months, we expect the baby to sit with some pillow at the back. That is sitting with support. That is what we expect. Otherwise, we are not worried about it. Where can you see the podcast? So our podcast, Ask Dr. Gbemi ATP podcast, is available in all the podcasts, so Google Podcasts, Amazon Music, Spotify. So if you just go to any podcast platform, and I think you go on our Facebook, you see the link as well. Any of the podcast platform, just type Ask Dr. Gbemi ATP podcast. You just Google it, Ask Dr. Gbemi ATP podcast. It will take you to our podcast. But we're available on Spotify, Google Podcasts, Amazon Music, all the Spotify and all the podcast platforms. We are available there. Yeah. Or if you ask on our group, somebody I'm sure will be able to send you a link. Should I be worried if my 6 months isn't rolling over yet? I'm not worried about it. Most babies roll from 5 to 6 months, but that is when they start to do that. Some children will be a little bit later. Just like when we're saying child is not working at 1 year. Most children work at 1 year, but some will not work until 18 months. So we always give children a little bit of time. If this child is doing every other thing else, I'm not going to worry about it. But if the child doesn't have neck control, the child is even not sitting with support, I will worry about that. But if the child is otherwise fine, but it's only the rolling, I will just give the child a little bit more time and see how it goes. All right. Okay. Thank you so much. Our time is gone. Today is a good day. We have so many people asking so many questions. Well, I have to go now. But if you still have any questions about the health of your children, our Facebook groups are open Mondays to Saturdays. So you can always post your question anytime, 24 hours every Monday to Saturday. and we'll try and answer them. We have lots of resources online already. We have our website. If you look at my background, you will see all those information. We have our website where you can ask questions. Okay, let me remove this so that people can see. So you can go on our website at www.askthepediatricians.com. We're on Instagram, we're on Facebook, we're on YouTube, we're everywhere. And most of those podcasts as well, most of those platforms, you can learn a lot. If you post your question on our Facebook group, we will send you the links, we will answer your questions, and we will support you in raising healthy children. So I'll see you again next week, God willing. But before then, remember to take all your immunization. If you've missed any, you can always catch up. I think that will be my message for the week. Have a wonderful rest of your day, and it is bye.